start?
Yes.
Okay. Right. We all know what is pharmacology. What is pharmacology? In simple way, it is a study of drug. What is a drug? The active ingredient which is present, which got extracted having some action on our body. That is a drug. So it could be beneficial or it could be having adverse effect. So if we are studying that drug action, that is on human beings. Anything which we are studying a drug on human being. So study of drug on human beings is clinical pharmacology. Here, like we say, clinical college, or we say, are you with preclinical or paraclinical or clinical? There are many subjects in medicine. We have different subjects. The person who does the clinical treatment, that means he is directly contact with the patients, is a clinical. Who is a patient? Patient is a human being. So it is a clinical pharmacology. Actually, pharmacology is a paraclinical subject where knowledge of drug, until unless we don't know the knowledge of drug, we cannot go and study on patients. So we have to study it on volunteers. So that is why it is paraclinical. But if it is clinical, means the pharmacology which we are dealing directly with the patients, that is on the human beings. That is clinical pharmacology. So this also you should know. Then we have chemotherapy, as I said, another branch.
It is study of drug and study of human being.
Study of drug only on human beings is clinical pharmacology. Chemotherapy. Chemotherapy. Therapy is treatment. Chemo means chemicals. With what we are doing in chemotherapy, treatment of infectious diseases. If it is an infectious disease, infection, how we get an infection? We get infection from microorganisms. So it could be a fungi, it could be a bacteria, or it could be a virus. So with all these microorganisms, if we are treating those microorganisms, altogether we call it as chemotherapy.
Right.
That is a chemotherapy. Like example,
Infected?
yes, even neoplastic cells. Neoplastic cells also comes under chemotherapy, like anti-cancer drugs. Also chemotherapeutic agents, we say. Okay, then we will go and study some important drugs in allopathy, how it is classified broadly. Like example, we have orphan drugs. What is the meaning of orphan? Orphan. The drugs, orphan drugs, are the drugs which are used rarely, which is not used in normal practice. Those drugs, the use of those drugs which are used very rarely, means for rare diseases, are called orphan drugs. Like example, digoxin toxicity. Digoxin toxicity, that is digitalis toxicity. When we use digitalis, when there is a heart failure, it is not for all purpose, all times we are using. We are using in rare situations like digoxin toxicity, that is digitalis is a plant, digitalis purpurea, where if the toxicity of that, because the drug has very narrow therapeutic index, so hence if at all there is any toxicity, we use that as in a category called orphan drug. Then Other example is cyanide poisoning. Cyanide poisoning. If it is cyanide poisoning, we use the drug called sodium thiosulfide. Thiosulfate, sorry. Sodium thiosulfate. So sodium thiosulfate or digitalis is a rare drug because we don't see getting cyanide poisoning oftenly. We see this are rare cases. So these are orphan drugs. And also another example is sickle cell anemia. Sickle cell anemia. So sickle cell anemia, this condition, anemia, where the RBC cells looks like sickle shape. So due to its sickle shape, movement of RBCs will not be easy. So there will be a rupture onto that area and the RBCs gets hemorrhaged. So this disorder is not a common disorder. It is a rarely disease. So for this, thalassemia is also a rarely disease. Yeah. Rituximab is a drug which is used. Even this also comes under orphan drugs. So now what we understood about orphan drugs are the drugs which are used rarely, which is not used in common. And these are the examples with which we can see that which are the drugs used rarely. There are many drugs where we can read it by knowing the mnemonics, we can remember the drugs. But I have taken few of them. Okay. Then we have essential drugs. Essential drugs. What do you mean by essential drugs? So the name itself is saying these are the drugs which are needed at any time, at any given time. A maximum number of population may need these drugs at any time. So one has to have the proper storage of these drugs. Like example, when there was corona, vitamin C was an immune booster drug and it has to be available in the market everywhere. So it is an essential drug that time. Even a paracetamol, even a azithromycin. So all these, whichever the drugs which are commonly used are essential drugs. Then there is another drugs called prescription drugs. Prescription drugs. Prescription drugs. So in prescription drugs, we need to have a prescription to dispense the drugs. If a person wants particular like Schedule H drugs, he has to have prescription. Like example, antidepressants. Antidepressants are the drugs with which a person want to buy these drugs, he has to have a doctor's prescription. So, and antibiotics especially. These drugs should not be dispensed without a prescription. So those are prescription drugs. There is another category of drugs which are called, they are also drugs because that is altering our normal physiology. Any alteration of normal physiology is called drug. So there are non-prescription drugs. What do you mean by non-prescription drugs? The drugs which we are not using, which without having a prescription, we are buying those drugs and we are using it without the knowledge of doctor. So here doctor is not needed. We know our body, what is happening today for us. Like example, Vicks. If I want to buy a Vicks inhaler, do I need to go a doctor asking whether I can go with a Vicks or not? If I am getting cold, I am taking Vicks inhaler. So that is a non-prescription drugs. It's a bowl. We are using it as a laxative. We don't need any doctor. Senelax. We are using it for constipation. We don't require doctor. So Azulax granules, we don't require any prescription. We can directly pick up from over the counter. So non-prescription drugs are also called over the counter drugs. They also alter the physiological functions, but they don't need any supervision. They don't need any doctor's prescription. That is non-prescription drugs. In pharmacology, how we get these information, from where we get these informations. So sources of information is very important. The next topic is sources of information. Sources of information. How we can collect these information? We have standard books. Those are the standard books. Those books wherein which all A to Z of the drug will be given. What is the color of the drug, how it is prepared, how it is preserved, how it is given, and what is its duration of action, what is its onset of action, what is its half-life, and how it is excreted out, what is its ADME, and what is its mechanism of action. By having a raw drug till its excretion, every detail will be given. In what temperature it can be kept, stored. So what is its shelf life, how it is manufactured. All that information is a standardized form by naming the books called IP, BP, USP. That is Indian Pharmacopoeia, British Pharmacopoeia, or United States Pharmacopoeia. And there is a national, international formulary, that is NF. This every country has its own international, that is national formulary. This formulary will make a person to know about the drug action and when and which disease it is given. So even with this also we can collect the source of information either from this or from this. And also there is one more called Martindale.
The NF stands for
National Formulary. Martindale. Martindale is a just like pharmacopoeia, but it is called extra pharmacopoeia. Extra pharmacopoeia is Martindale. Then we have
कौन सा अच्छा है इसका
yes,
बुक्स लेने के लिए
हाँ.
ऑथर कौन सा अच्छा रहता है
These are the standardized books. Here we cannot change anything in that. So time to time, as there is an updation of these books, some drugs which should be eliminated out will be eliminated out by the body. It is the government, under government supervision, these books will be made.
where we get the books
It is available in the market. With the volumes, it is available. 2012 there was a IP release. 2014, 2018 there was a new edition came. So all these books, where we can collect it from these, it is present in libraries. It is present in institutions. You can collect it anywhere. You can have it online also. These books. So where we can get all the data, and also there is physician desk reference. Physician desk reference. Physician desk reference. PDR. Physician desk reference, where we can get the knowledge of the drug, how it is used and what dosage it can be used, and with what conditions we have to use these drugs. Then we have textbooks. There are many textbooks. Like example, if you go with the pharmacology books, We have very standard books like Goodman and Gilman. That's a very standard book. It is called Bible of Pharmacology. Then also we have, for our levels, for doctors to know exactly what the drug is, to easily understandable, is KD Tripathi. That is also a very good book. Then we have Rangendale,
KD Tripathi.
KD Tripathi,
KG.
KD. KD Tripathi. Then also we have Katzeng, we have Satoskar, and we have many other authors. Very good books we have. And then along with these textbooks, we have journals where we can know about the pharmacology. And whenever there is scientific conferences or seminars where new investigations, their protocols, they will they'll present their papers, where we can go and study in pharmacology department what new things they have done. Like recently I had been a conference where I have seen in pharmacology department, agmatine, it's a neurotransmitter, which is a CNS neurotransmitter. There was a much more research work which was done in JSS Medical College, where I came to know many things about that agmatine neurotransmitter, which is a new neurotransmitter which was highlighted there in that conference. So in that way also we can get the information, and also we can get the information from bulletins, and more, not the last but not the least, database. In database we can get any sort of information. Database is on our fingertips whenever we go with a Google, and we will get the complete drug information. So these are the sources of information where we can, if we want to have extra knowledge, you can acquire it, and it is open to everyone. Those who have a thirst to acquire the knowledge, we can get it. So if we are thirsty, we go and search water and we have it. So same way, if you want to have pharmacology in understandable way, there are many sources where we can collect these things. Now, let me conclude my topic by last topic, that is drug nomenclature. Drug nomenclature. Nomenclature means, nomenclature is the naming of drug. So how to name a drug? In what way we call the drug? Like if I am Dr. Asad, people will call me Asad. So that is my identity. How we can identify a drug? That is what in pharmacology, how we name the drug, that is drug nomenclature. In drug nomenclature, like example I will tell you, until unless if we don't know the ABC, we cannot go with nomenclature. To know the nomenclature, we should know what is ABC. First thing, with example I will tell you, if I take Dolo 650, this is the name of the drug. Yes, we know, we all know it is a name of the drug. Keep this as one, and then we know paracetamol. This is also a name, right? Then we also know the name as para-aminophenol or acetaminophen. This is also we know. Is these three one and the same? Exactly, it is one and the same. There is no difference here. If you know about the drug nomenclature, we should know what is ABC. That is, Dolo 650 is a proprietary medicine. Means, I have a company, I own a company, I want to make a drug by giving a brand name, that is my own name. So, Asad 650. I can give anything because it is my own company. So whatever the thing which I am using it, I am giving my own name, Paul.
One.
It is own name. But this is a proprietary name. It's a brand name. But in that name, what I have used, the active ingredient, that is paracetamol. So paracetamol is a non-proprietary name. Means nobody can change. Whatever, if anyone is using paracetamol, he has to mention the name of active ingredient as paracetamol only. He cannot change. That is called approved. It is called approved, or it is called generic name. It is called approved name or generic name, and it is a non-proprietary
Yes.
name. And then what is this? Para-aminophenol. What this paracetamol is? It's a name, but it is in a standard books. It is given as a chemical agent as paracetamol. This paracetamol, if we see a formula of paracetamol, we will find it that it is, this is a phenol, right? Benzene with OH is a phenol. With phenol, if we add amino group at para position, this is para position, this is meta position, this is ortho position. Near to the functional group, the first one is ortho, meta, and then para. To the para position, if we add para amino phenol, then it is a paracetamol. This is a chemical name. So the chemical name, chemically it is also called acetaminophen. It is a para-aminophenol and it is a paracetamol, and the brand name is Dolo 650. It is a chemical name. Chemical name. So approved name, chemical name, and brand name. Brand name. That is what. Approved name, brand name, and chemical name. If we know ABC, then we can easily nomenclature the drug in its form, whatever it is. So that source of information, we can collect it and we can know the pharmacology, whether it is pharmacokinetic or pharmacodynamic. In dynamic, how this drug is acting, with which receptors it is binding, and how much time it is in a binding form in a blood. So what is its duration of action? All that study we can do it. Basically, drugs are non-polar. They are lipophilic because the drug has to cross many cells of our body. Until unless they cross, they cannot elicit its pharmacological action. How it is getting into the body? It is because our cells are made up of a bilayer, which is a lipid layer. It is called lipid bilayer. So lipid molecules can easily cross. If polar, then it is very difficult to cross. Water soluble will not cross. But once it shows its action, the pharmacology ends here when it gets metabolized. Metabolized means the form in which the body don't want that drug to be in the body because it has shown its action. It has to be eliminated out. To eliminate it out, it is now hydrophilic. It will become hydrophilic. That is called biotransformation. The drug is transferred into a form where it can be easily excreted out. It will be an ionized form. It will be in a polar form. It will be in a water soluble form so that it can be excreted out. So that is what we are going to study in pharmacology. In simple way, as in my earlier classes I mentioned it, pharmacology is the extent of physiology. Until unless we don't know the physiology, we cannot study pharmacology. To know the mechanism of action, we should know what is the physiology of the normal function of that particular organ which is disturbed. So for that disturbance, how we are using a drug to alter that disturbance, physiological, pathological, back to physiological. That is what the pharmacology is. So today's session I am going to conclude today. So in next class we will go with pharmacokinetics of each, what is absorption, how absorption is taking place, how distribution of drug is taking place, how it is transformed, biotransformed, that is metabolism, and then how it is excreted. For all these things, in our next class we are going to study to see to each and every places from the drug, from the absorption into the blood, then to the tissues, then again back to the blood, again to the tissues, again back to the blood, again how this passage transport is taking place. The drug transportation for all these stages of ADME is depending on how this transport mechanism, a common transport mechanism that we will study in the next class in a very satisfiable, understandable, easy way, and slowly we will go, and until unless we know the transport, then ADME will be very easy. In specifically the A, what is D, what is E, what is E will be easy. So with that I am going to conclude my class today. So we will see you in the next week. Assalam.
Sabe, por